Hello, family and friends. Last week we discussed how quickly and silently drowning can occur. Today, let's talk about who is most at risk. Certain groups are disproportionately affected by drowning. Almost 80% of people who die from drowning are males. For children ages 5 to 14, drowning is the second leading cause of unintentional injury death after motor vehicle accidents. And drowning does not affect all communities equally. Black children ages 5 to 19 are more than 5 times more likely to drown in swimming pools than white children. A disparity rooted in historical barriers to pool access, limited availability of swimming lessons, and generational gaps in swimming ability. And American Indian and Alaska Native communities face the highest overall drowning rates of any group in the United States, but for a different reason. Many of these communities are located near rivers, lakes, and coastal waters, where daily life activities involve frequent contact with open water, often in remote areas with limited access to lifeguards and emergency services. In both cases, systemic inequities, not individual choices, drive these disparities. Economic factors also play a role. Children from lower income households are less likely to have access to swimming lessons and water safety programs. Now, let's take a look at certain medical conditions that can increase the risk of drowning. First, children with autism are at an increased risk because they may be attracted to water and may wander away from their caregiver. Studies show that children with autism are approximately 3 times more likely to drown than children in the general population. Second, individuals with seizure disorders are also at increased risk, especially during bathing and water activity. People with seizures are 7 to 10 times more likely to drown than the general population, and nearly half of drowning deaths occur in the bathtub. For this reason, experts recommend that individuals with seizure disorders take showers instead of baths whenever possible and avoid being alone in or near water. Third, heart disease is another important risk factor. Sudden cardiac events can occur during swimming or other water activities, particularly in older adults or those with underlying heart disease. A Canadian study found that many adult drowning victims were middle-aged men who were alone, swimming or boating in lakes or ponds, and often had an underlying medical condition. Lastly, adults should be aware that alcohol, illegal drugs, and sedating medications can impair judgment, coordination, and reaction time around water. Now, to reiterate, if you have a medical condition that could affect your safety in the water, such as a seizure disorder or heart disease, or take medications that can cause drowsiness, discuss water activity precautions with your healthcare provider and avoid swimming alone. The good news is that drowning is largely preventable. Join me next week as we discuss simple steps every family can take to prevent drowning and protect the people they love. Stay safe and stay informed.